Well, bronchial asthma is one of my areas of interest, scientific interest and practical interest. No? As it is well known, bronchial asthma is an inflammatory disease. It's an inflammation of the mucosa of the bronchi. And this inflammation afterwards can conduct to a bronchoconstriction. No? And this bronchoconstriction is the one who makes the symptoms. There is dyspnea or breathlessness, cough, and sometimes even expectoration and tightness of the lung. No? The problem one of the problems of treating with asthma is the diagnosis. First of all, the physician, the pulmonologist, must make an accurate diagnosis, because many other disease or some other disease may mimic asthma, no? And if we don't diagnose very well the present disease, we will be wrong with the treatment, no? So first of all, a very accurate diagnosis must make the doctor, no? And also one thing that we must be aware is of the circumstances around the patient, which are the causes of the exacerbation. For example, you have a virus, they have had an environmental problem, for example, dust mites, or in the work, for example, isocyanates, or he has a dog or has a cat, and all these problems. This is very important to look for and try to avoid during the treatment. No, we have in Barcelona in the 80s the epidemics of asthma. No. And after a very comprehensive study with many, especially we participate, we found that the cause was that soybean that was unloading in the harbor. No? And at that time, at least 25 patients died from asthma, because it was very serious asthma. No? And after the study, no more patients we have had with asthma due to soybean. So this is the importance to find the etiology of the exacerbation. Well, once we have done the diagnosis, we have a very good treatment. Nowadays, I think the treatments are very effective. We give the drug by inhalation because it's easy, and with very few quantity of drug, it's very effective. The problem we have is that the patients most of the patient or some of the patient that doesn't do the treatment. No, they don't do the treatment because they forget, or because one day he hasn't buy the drug and it's not near him. And so the problem with the doctor in the visit is to try to explain very well what is asthma, to try to convince the patient that the necessity and the importance of do the treatment, because if they do the treatment, is near sure that the patient will be controlled, and after the asthma will not get worse. That if you don't do treatment, you can get worse in the future and make the disease even irreversible. No?